Hello, and welcome to our webinar with Dr. Tom Tully, Ask the Vet with Dr. Tom Tully. We will get started shortly. Let's give people time to log in. And I am going to share some funness, hopefully. Let me see if this works. And while we wait for people to log in, let's see, hopefully this works. Can everybody see? Oops, that's not what I want to see. This. Can you see that, Dr. Tully?
No, I see you.
No. Okay, that didn't work. Then let me try it again. I'm going to share my screen, and boom. Okay.
Yeah, there you go. There you go. We're going. Okay.
So just while we wait for people to log in, again, you're at the Ask the Vet with Dr. Tom Tully webinar, but we're going to let people log in for a little bit. I just thought this was really funny. A friend of mine shared this with me recently, and I am just very curious, how in the world are they getting those pigeons to pull those little sheets off?
Well, obviously they're tired of being a bird.
That's true. You know, it's hard work. You got to forage all day outside, and you got to deal with pedestrians and cars and what else, you know?
Yeah, that's right. They said, I want something better.
I want to take a break.
Yeah. Be careful what you call for. You just may get it, right?
That's right. That's right. Love it. That reminds me, if anyone has a fun thing they came across the internet with birds, like send it to Lafeber.com and I'll see if I can share it on one of our webinar as we wait for people to log in, because who doesn't like to see materials about birds, right? Okay. All right, we're gonna have one more go here. Check these guys out. They have been either trained to pull paper off, or there's something on that little tab of paper that they are just hunkering for.
I think there's something on the tab of paper that some drop of some substance. As you can see, it looks moist.
But it is a pretty good trick. Whoever thought of that. It's,
yes. And it looks like before they put it on, that they put the little drop on after they tape it. I don't see it on there. And then when you see the pigeons picking it off, you see the little drop.
See, you are a very good investigator. Like, see, that's why you're a vet. You have that keen eye for things.
Yes.
All right. Okay, I'm going to stop the screen share. That was just a little bit of funness for now. And here we go. So if you're just joining us, you're at the Ask the Vet with Dr. Tully webinar. My name is Laura Dorian. I am your host. And I think we will just, we already have a couple of questions queued up here. So we'll just dive right into them, because some of them are pretty complex.
Let's do it. Let's the whole hour on the questions and see what we can come up with here. Okay,
so out the door, this is our first question, and it's bear with me. It's a little bit we got to give the whole case history, so it's a little lengthy, but it's worth reading. Okay, this is from Jade, and he is from Quebec, Canada. It says, I own a male cockatoo, the age of which is unknown. I adopted it in September of 2019. In March of 2020, my cockatoo started to feel nauseous. I went to the vet hospital, and they treated him for heavy metal poisoning. Once the particles are cleared and back home, he doesn't have much energy and eats little. I syringe feed him morning and evening, and he feeds himself during days with Tropican and Lafeber pellets. Since returning from the hospital on an empty stomach, he has been making tiny droppings filled with bubbles. When I feed him, his droppings are nice and bubble-free. Sometimes I hear the stomach making bubble noises. We had stool tests and everything is fine, no bacteria or fungus, but the vet still gave him antibiotics and antifungals. The bubbles are still present 3 months later, and he also continues to swallow rocks, metal pieces, and wood rather than his own food. He's obsessed with eating rocks when I take him outside. His x-rays show a ventricle filled with several particles of all kinds, but the metallic ones were removed during the endoscopy in March. My vet suggests a test to check if he is a carrier of Bornavirus. However, he has no neurological symptoms. His droppings do not contain any undigested food. Also, the vet also suggests taking a pain reliever for his stomach, but he shows no signs of pain. What do you think? Should the bubbles in his droppings worry me? Do you have another lead or idea? And that is that question. They also sent in the radiographs that they have from their vet. So I'm gonna try to share those as well. Okay, I'm gonna bring those up on the screen. And okay, so can you see that?
Yes, we
okay.
can. Yeah.
So what can
well,
you tell
that was a long question.
Yes, it was.
You know, but good explanation from the Lafeber supporter in Quebec. The first thing that I want to mention as far as that question goes is that that as you can see, and everybody that's on the the webinar can heard that it's a very complicated case. As you can see in this X-ray, you can see the foreign body, the metal, the bright material in the stomach, that could be in the ventriculus, which is the muscular stomach, and so yeah, this was probably taking before, from what I'm to understand, that they did an endoscopy to remove that. Is that correct?
I believe so. I'll double check that.
But what was?
Yeah, the metallic ones were removed during endoscopy. Yes.
Okay. So it and so some of the, if you have a zinc toxicosis, and zinc is somewhat common in our environment, that if there is an overexposure to zinc, that it can affect, have an adverse effect on the gastrointestinal system. Many times birds will regurgitate, kind of vomit, but regurgitate. They can have different issues, diarrhea, gastrointestinal issues, somewhat similar to what this person describes happening in their bird. And that's with zinc. You don't necessarily have so much, you know, that presentation with lead, but I would say that it's not uncommon to be exposed to lead, but probably birds have a much better chance of zinc toxicosis. And that's from toys. We have birds that swallow pennies that are primarily zinc after 1982 or something like that. Even today, trivia question, costs 2 cents to mint a 1 cent coin. How about that? But it's even less with the zinc, and they're not all copper. But that causes toxicosis itself. So we have had toxicosis, and we had birds that would lick in Puerto Rico. That a lot of the cages are galvanized. Galvanized contains zinc, and there would be dew droplets, and they would get zinc toxicosis like that. And people sometimes have a zinc-coated water container, and that is a way they can get zinc also. So you don't necessarily have to have the metal in the bird. They can still have high zinc levels that'll affect their GI tract. But in general, the body can handle, zinc is a nutrient within our bodies. People talk about taking zinc for colds and better health, but too much of anything is not really good, and so you can have the zinc toxicosis. Now, on this case, what concerns me is really the owner, and you can read it, Laura, and I don't think I misinterpreted, that the bird still eats wood, metal, still, you know? And so when you look at that, that's somewhat unusual. Most of the birds aren't going to ingest all of this material. Some will. Now, with that in mind, that you have to consider that they will do that, then you need to do everything possible to reduce that. What that also means is that although they treated this condition before and it's still with them, that it could have been re-exposed to something after the treatment, and they are starting back where, they're back where they started. Okay? I mean, it's not unusual for us to remove endoscopically metal from a bird and have it return 3 months later with metal back in the bird. Okay? Just because you remove it doesn't mean that they can't readjust it. Also, when you're looking at heavy metal, like I had mentioned, lead and zinc, just seeing the material in the body is not really the diagnostic test of choice. You want it, if it's in there, you want to see it and take a radiograph. But to get a definitive diagnosis and to actually clear a bird, meaning that it doesn't have heavy metal toxicosis, you need to run a blood test, and you need to look at blood levels of zinc and lead. Give you for instance, we had a Amazon parrot come in one time, and the bird had signs that were very typical of lead toxicosis, with GI signs, with the color of the stool, and I very, very typical of an Amazon with lead toxicosis, and it was very, and the bird was just perching, and it wasn't even doing, it was just like, don't touch me, don't say anything to me, just let me be, and that it was just perching like that, not very responsive, not very reactive. I told the owner, I said, it's not often I can come in and say, I think I know what's wrong with the bird. And I said, but I think that it's lead toxicosis. And the owner, of course, whenever you mention that, well, not with this owner, with this bird that we're seeing here, but most owners will say, Dr. Tully, I know exactly where my bird is. I know what he does. I know what he eats, and I'm not feeding him lead. He's not getting in any contact with lead. I've had from the most experienced bird owners tell me that to the most novice. And I don't say, hey, you're wrong, because most people don't realize how the bird is exposed to lead. And I know they're not feeding them lead. Well, just a long story short, I did the blood levels. The bird did pass away, and the lead levels were, off the chart. And the lady was from far away, and I waited till she got home, and I had the test results, and I called her, and I said, I hated to tell her, but the little bird passed away, and but I can also tell her that it did come back that it was lead toxicity. And then she goes, well, she says, oh, Dr. Tully, I'm so, I feel so bad. I got home, I talked with my husband, and she said, we killed the bird. And then she said, no, my husband killed the bird. And I said, well, no. I said, it died of lead toxicity. And she said, well, when the bird would take the clapper out of its bell, and so the husband said, well, I'll put one in there that the bird will not take out. And what did he put in there? A lead fishing weight, not knowing that the bird would eat the lead. And that's what happened. And guess what? They couldn't find the lead weight. So if the bird ate that lead weight or ate a significant part based on the blood work, when I'm talking about, heavy metal toxicosis and seeing it versus the blood work, I said, would you let us take a radiograph? Because the lead levels were off the chart. Would you let us take a radiograph, even though the bird's dead? I'm paying for it. I just want to see if we took a radiograph. I did the blood work and didn't take the radiograph. I said, if we do take the and so I went to that directly. But I said, let's just say somebody said, well, let me take a radiograph like this bird here and see. And when I did that, and we took a radiograph of the bird with the lead levels off the chart, guess what? We couldn't see any lead. You wouldn't have been able to tell that it had heavy metal toxicosis because it was so small within the bird, and or passed through because of how it was probably shaving that lead off. And so radiographs or x-rays do not always tell if you have heavy metal toxicosis, which is why you need to do the blood work.
Here's another view of that.
Go ahead and take another view of that. Now, there was a mention, I guess, also about Bornavirus on that, huh?
Yes, the vet suggests to check to see if the bird was a carrier of Bornavirus.
Yes, and so Bornavirus has been implicated as implicated to be associated with proventricular dilatation disease, and then some people have taken that to mean that it causes proventricular dilatation disease. At this point, I don't think that we have an understanding to actually say that. It appears that there is some type of connection, but there are birds with proventricular dilatation disease that they cannot isolate the virus. And then there are birds that have the virus that have never developed the disease. So, having the virus without the disease, it doesn't, so what does that really mean? If they have the disease and they don't have the virus, and they have the virus but don't have the disease, where does Bornavirus come into play? It appears to be associated, so there's a good chance that if you have clinical signs of the disease, that it would be positive for Bornavirus. But the only way that you can confirm PDD is through tissue biopsies and actually finding the pathology that's associated with it. What I feel is the best, if you think that you have a Bornavirus or you have proventricular dilatation, to me, the best diagnostic test is what we do is we do contrast. We'll do a contrast study where we take barium, put it in the crop of the bird, and then while the bird is perching, we don't put it under anesthesia. We take moving radiographs and fluoroscopy, it is also called, with a C-arm, with a special type of radiograph unit. And we have them in a little box perching, and you see the bird just sitting there, perching around, looking around, and you're looking at that barium go down through the GI tract. And you monitor that barium to see the functionality of that GI tract and to test and see how quickly it goes down. That to me is the optimum test. It's something that I believe this bird should have because of the GI issues. Also because if it's eating all of these things, what may be affecting that GI tract is it may have ingested something that you can't see radiographically, meaning that it's a radiolucent or something that the X-rays will not pick up on, like metal. It'll go through it like plastic or something like that, that could be irritating that GI tract. And so and sometimes with barium, contrast study of the GI tract, you could see what that is, and also it outlines the GI tract better. I like the functionality of like the fluoroscopy to actually see the contrast flow through, but at the very least you can do a contrast study to find out more. So that's it. That's what I have for this case.
Oh, and just as a follow-up, so they had asked the bubbles and the droppings. Is that, I mean, if you see bubbles in the bird's droppings, is that something that should be an immediate red flag, or?
If you see, not necessarily. I don't see it as a red flag. I you know, if you have, what I try to monitor is the consistency of the stool, the color of the stool, what would be considered normal of the stool. If you have bubbles in the droppings, there may be an issue, but it could be transitory, because depending on what's being fed. But if it is abnormal in a sense, then like I said, there's a diagnostic test like contrast, especially if you have a patient that has a history of ingesting what we call foreign objects. They're not foreign to us, but they're foreign to the GI tract. So a chain or money or coins are foreign objects. Also, if you do have bubbles in the stool, is it due to an increase in gas within the intestinal tract? Is it due to flaccidity or within the cloaca? And then of course you have urination and defecation coming out of the same vent area. So you want to try to determine if it's urine or if it's actually stool and feces, and the difference between diarrhea in most cases, in most birds, you have some birds that have more of a liquid stool. If they normally eat a liquid diet, a lot of fruit, things of this nature, the stool will be not as formed. But most of the stool, you have the urine portion, and then you have the formed portion of the fecal material. That's normal. But if you have it all mixed up and you don't see formed stool, and that's why it's always good to know what normal is, and there's no correlation to what the bird's been eating, then I would say that you're actually then the unformed mixed urine and feces is more like diarrhea. If you have bubbles in it, there could be issues that may be associated with a bacterial infection, and if the bacteria cause a buildup of gas, then that may be it. And then, like I said, if there's a foreign body that's irritating the GI, that may be a problem too.
Okay. So before I close my screen share, just this area, that's a microchip. Can you see my cursor?
No, your cursor, I see it, but it's not by the microchip.
Oh, okay. Well, the
You're out over in the sky.
Am I really? Okay.
Yeah, yeah.
That's so weird. Okay. But there is a microchip on this bird, correct?
Yeah. Can you move your cursor to, yeah. Move it to your left.
Yeah,
right.
That's right.
Move it to your right. Move it to your right. Keep moving right. There. Up. Stop. Go up. Up. Go up. Right there. Right there is the microchip.
Okay.
Yep, in the pectoral muscle.
Okay. That's funny. On my screen, it looks like it's in the far, like the pectoral muscle is like on the opposite, like at the front. Interesting. Never know how screen shares are going to do. All right. So I'm going to stop the screen share, and I've got let's see here. Okay, and just to remind everybody that if you do have a question, to use the Q&A feature and not the chat one, because the Q&A one lets us capture it in case we don't get to it, then we can send you an email answer at a later time. So, all right, you ready for another one? This one's got a backstory as well. Here we go, and this is from Shadan, and it says, I recently adopted a bonded pair of senior Quaker parrots, reported to be about 21 years old. I took them to the vet for the first visit. She was only successful in withdrawing enough blood to get the full blood work on one bird. I was told to return in 1 to 3 months to try again with the other bird. Based on the bird's results, she believes that she has in the early stages of chronic liver disease and recommended a prescription for Hepato-Support. I hope I'm saying that right, which I have picked up.
Hepato-Support.
Which I have picked up, which I have picked up, but want to make sure before adding it to their food. Her directions are to open and sprinkle the contents of 1 capsule daily on their food for the long term. She believes it's okay to offer them both this dosage in their combined food bowl. So they're going to share the food bowl with this capsule sprinkle on it. Is this medication generally prescribed for parrots at this stage of liver disease? Is the quantity a safe amount considering their size? And the fact that the dosage appears to be the same for cats and dogs. Also, for the last few months, I have been feeding them organic whole milk thistle seeds. I was feeding them 7 each day prior to the visit, with a 1 day off each week. She said this was maybe a little too much and to reduce it to 4, but I could still give them that dosage of 4 each with the day off, even with the addition of the Hepato-Support. What are your thoughts and recommendations on both the hepatic support and the whole milk thistle seeds? The bird with the completed blood work weighs about 105 grams, and the other bird weighs about 127 grams. Do you have any generalized dietary recommendations? I feed them both fresh sprouts and vegetables daily, and they have access to pellets. Are there any foods to avoid or any to concentrate a little more on?
Yeah, I just, as far as that Hepato-Support, it sounds like it's a canine feline product based on the question. I'm not familiar with it. I know that silymarin and milk thistle is a kind of a hepatic, in silymarin, actually, if I'm not mistaken, is the active ingredient in milk thistle, and then that you can actually purchase that and utilize that. As far as the milk thistle, I'm not. I don't believe that what you're feeding is going to be problematic. I'm always afraid in many times with some of the natural products, that if you're looking for one particular ingredient out of it, let's say like you want salicylic acid, like aspirin, chewing willow bark, you would rather just get the salicylic acid as opposed to chewing the willow bark, where they can actually extract it from. So that's what is good about trying to get medication that's specifically the active ingredient. And so some of the products that are out there, what you're looking at is that there's no scientific basis of the effects of these products. Okay, there's no research that has been proven scientific evidence that they're effective. None whatsoever in Quaker parents. Basing it on that they have done scientific studies in dogs and cats, that milk thistle will actually be effective in birds, and that's the dose that is going to be effective in treating. We don't know, have no clue. It's based on an extrapolation, if there's knowledge in dogs and cats. And that's whereas many drugs, and we do research, and we're continuing to do research to validate the drugs that we do prescribe to birds. One drug can be different in one species of bird than another. That's what we struggle with. So, to answer the question, we don't know. It apparently doesn't appear that it's harming the bird in any way, and that's in many drugs. That's the case at some of the dosages that we're using. But as far as the benefits, I cannot say that how much, if any, benefits that you're going to receive, truthfully. As far as nutrition, diversity is always something that I promote with nutrition, and to make sure that you do provide some type of a base diet that will have vitamins and minerals, and I've said it on previous webinars, and I think it's psychologically beneficial to the bird, both through foraging, and also just the different textures and tastes that's involved. So I think that if you do have a diverse diet, that you'll come closer to probably providing the daily nutritional requirements of that bird than if you just give a single food item. And calcium, and I cannot emphasize it enough, needs to be part of that bird's dietary exposure through a cuttle bone, through a mineral block. If that's not, if you can't do that, but most people can put a mineral block in there or a cuttle bone calcium supplementation. But in general, that's always something that you have to be aware of, especially when we are providing natural treatments. And we have an integrative medicine program here at LSU, and we utilize integrative medicine. And you say, what's integrative medicine? Integrative medicine is Eastern medicine, your acupuncture, and your and also that includes some of the laser therapy. It also includes herbal medications. And so we have a service that is dedicated to that. We utilize them for our avian patients, and they have a product that they give us. They also prescribe it to the you know, they prescribe for our patients, our avian patients, and some of our other companion exotics called Liver Happy. And so who wouldn't want Liver Happy? Now, Laura, I mean, you know, if you have liver problems, you want Liver Happy, right? I mean, I don't know who came up with the name. I should have come up with that name, right? But
yes, good one.
and so the questioner could have asked me, like, you know, Dr. Tully, what do you think? You know, do you think Liver Happy? And so I can't, you know, I couldn't tell them if it's beneficial or not, but it does not appear to, you know, and there's a basis that they prescribe that, but there's absolutely no scientific evidence that of what it, you know, they're basing the ingredients on what it does or should do with the liver. But as far as birds, I could tell the owner, you know, we don't know, but this is what our integrative medicine service prescribes for liver disease. And, but we still have a way to go with our research, and there's always something new coming. So there you go.
Okay, that is very interesting. And so just as a recap, because I meant as far as the part about the early stages of chronic liver disease, is there anything that they would, anything to avoid in the diet specifically, or is it just like a well-rounded, balanced diet in general? Like,
no, and really I would have to, early stages of chronic liver disease. How old are the birds?
21 years old.
Yeah, so I would just say they're geriatric, and it wouldn't be any different than any other probably older animal. And the liver is very forgiving, and rarely, you know, liver failure itself. I can't recall that being a very common reason that we have deaths in parrot species. You know, I mean,
okay.
You can have liver involvement of other diseases, but liver, just liver failure in and of itself, no, it's not common. So I would say there's nothing to really avoid other than what is normally mentioned. You want to try to avoid anything that's high in fat, cholesterol. You know, you want to avoid heavy kind of oily nuts with great quantity or significant quantity. I mean, it's not bad to treat them to something and have it as a small part of the diet, but you want to do, you know, prevent that or reduce that. And of course, avocados and chocolate. But as far as the diet, the diversity, like I said, and the products that are out there now are very good, you know. And so we're on Lafeber website, so Nutri-berries, Nutri-pellets, and pellets or pellet berries. So these are all good, along with your what she had mentioned as far as some of the vegetables and fruit. Fruit for itself, fruit is just a treat. It's water and sugar. It's water and sugar. So when they say fruits and vegetables, like they're kind of combined as nutritional sources, in my mind, fruit is dessert. You know, it's you know, it has fiber in it. Okay, fiber. But that's why birds would like fruit. Not, you know, of course, they don't all like it, but or all the same fruits. But I would consider vegetables up here and fruits down here on the nutritional plane, just because I think vegetables have more of a nutritional offering than fruit.
That's a good point. Same with people too, probably.
Yeah.
Veggies, fruits.
Yeah.
So we got a question for, we got some really involved questions for you. Here's one from CC. First of all, I say thank you. Hi, and thank you as always. So I beg your thoughts on what the next diagnostic steps I should discuss with my vet. My Pionus has had bronzing feathers that resolved with Lafeber daily vitamins, but then she had E. coli in the fall. It cleared. Then in winter, a waterborne bacteria she was treated for. Then in May, E. coli again, or E. coli. And then bronzing seemed to come back around this time. If I understand, feather bronzing could be bacterial issues as well. The vet cleared her, saying all looked normal and made us get off sprouts, but her stools still mostly consist of water/urine. Polyuria to me is a sign of something is still ongoing, but my vet says this is likely her normal. It wasn't, let's see, it wasn't leading me to seek treatment. She has had her kidney and liver values show normal. What test should I insist on doing next? And then let's see, I think there's a second part to this question. I'd like to add that her diet has remained constant for us as far as liquids go. So she gets cooked chickpeas versus sprouted, very limited, if any, fruit, limited pellets, no more than one tea fat source daily, not very diuretic veggies. So I am confident that polyuria is not food specific. Her stools were perfect before, like a paint drop dab. So that is it. That is the mystery for CC's Pionus. What can you tell us?
Yeah, and so you have an idea of what's normal, and thank you. And with the stool, and of course, there has been a link to sprouts being exposure to bacteria. E. coli, depending on the clinical signs or lack thereof, can be either a pathogen or not. So what I would, meaning it could be a problem, or it could just be kind of normal, okay, for that bird. As far as the bird itself, you have some bronzing of the feathers, and the one always with GI, and when we're talking about stool, I always say what comes in goes out. That has a big effect on what the consistency, the color. Anytime that there's a change in the stool, the first thing is, what are you feeding? And so often whatever the stool looks like is directly correlated to what is being fed. And so and if you manipulate some of the diet to a specific degree, you sometimes change the populations of the bacteria within the GI tract that maybe you don't get the most adequate digestion, and so you get some of the change in the stool and change in the bacterial I guess isolation. So I think that you had mentioned the renal values and liver, and I always go back to, what's the bird's body weight? Is it eating? Is it bright, alert? Are there any other clinical signs of disease? Then is the bird maintaining its weight and body condition? And if it's doing that, then I would say that it would be something like, I would be more along the lines of leaning toward stabilizing that diet and placing it in making sure that the bird was eating a certain diet that would be, you said minimal pellets, kind of and if it has seed in the diet, to a percentage of the diet to seed, to kind of have a bulk in within that diet, along with what else you're feeding. Because if you have a diet that's higher in vegetables and peas and things of this nature, you may not have the same consistency of the stool. Now, of course, the stool, you say, well, that's what I've been feeding all the time, and it just has changed. You know, I think that over time that there may be some differences in the products that you purchase or feed that could cause some of these inconsistencies that you're seeing. Now, if you have issues that's ongoing, then it may have some other you had the culture and sensitivity, and then obviously, you know, I'm not really sure if it was pathogenic or not. It's possible, and you treated to see, and it continues. Then you can do radiographs or a contrast study again, like I said, as other diagnostic tests to see what the function is. But at this point, I don't really see anything that you can do specifically to try and remedy that, other than try to modify that diet to get some regulation in that diet, so you can get some bulk in that diet, to try to see if you can get a better formed stool.
Okay. I also have a question from Steve. They ask, is there such a thing as feeding too much fruit or veggies? What is too much of that, if that's the case? Also, can Nutri-berries be used as a regular diet instead of seed? If fruits and veggies as well. So can you feed Nutri-berries as a regular diet instead of seed, in addition to fruits and veggies? I also, let's see, I also feed Pretty Bird, but he doesn't eat much of it. Thanks again. Let's see, is 12 hours sleep really important? My bird really only gets about half of that, so I'm concerned. I don't have a spare room, and I don't have a cover because it might scare him. So there's a bunch of little questions in that.
Yeah. I would say if Dr. Lafeber was right here, he would say, yes, you could feed Nutri-berries. So I'm going to quote Dr. Lafeber on that. So I will say that. And the Nutri-berries, of course, have a pelleted core in that has nutrients in that. So you could just feed Nutri-berries, but there's also pellet berries that you can feed that are fantastic, also that are primarily pellets with seed foraging diet. So I'm going to answer that question. Yes, I think that as far as feeding too much fruit or vegetables, there is a possibility if you do that, that the bird will only eat the fruits or vegetables and develop some nutritional deficiencies, because it only eats those. You have offerings, but you continue to give what the bird wants to eat. We had a hyacinth macaw with a vitamin B12 deficiency, because the owner was a very good owner and fed it a very diverse diet, but the bird only ate the macadamia nuts. Macadamia nuts. I would only eat macadamia nuts, okay? But macadamia nuts, just like Brazil nuts, have no vitamin B12. Who worries about B12? I don't go around going, did I get my B12 today? Well, guess what? If you have no B12, you become severely anemic and you can die, because you need B12 for blood development, to develop blood cells. So the bird was fed a diverse diet. So fruits and vegetables, I think, and I don't want to use them interchangeably because I give a lot more credibility to vegetables, but it should be given in modification. And I think that there's also, you have to make sure that they're fresh. You have to clean and make sure that they're fresh. It's not something you can leave in. But you know, in Pretty Bird and the pellets, that's fine. As I've mentioned before, I have a bowl of the seed and Nutri-berries or Avicakes, and then and all in a bowl. I have a bowl of pellets, and then I would have some vegetables or fruit in for my parrot, and the seeds and the Avicakes and the Avicakes and the Nutri-berries it would eat pretty quick. Then it would get to the pellets, and then you know, in between the fruits and vegetables. But that's kind of the diverse diet on that. So there was another question on that.
Well, the other part of the question was about the sleep.
Oh, the sleep.
Yeah, the bird not getting
Guess what? Yeah, if the bird enjoys it, for the most part, the recommendation is the birds to provide that opportunity for them to get the rest. However, if it is doing well with the amount of time that you know it's getting the sleep, I'm not that's not a problem, you know, as far as my thoughts are. If the bird is having issues, behavioral issues or something, and you know, is only getting 5 hours of sleep or an opportunity thereof, or if, you know, it's in the room and people are up to 12 or, you know, 11:30, you know, then I would say, hey, let's try this. That would be if there's an issue. If there's no issue, the bird's doing fine, I don't have any problem with that. Good question, though.
Yeah, definitely.
But if there is a behavioral issue, that's something that I do look at.
Okay. What do you know what would show as like a tired cranky parrot?
Feather picking.
Okay. Or just, I know when I don't get enough sleep, you know, I can be a little cranky the next day sometimes.
Yeah,
you know, your bird might be fussy.
You don't pull out your hair, Laura. You know?
No. But maybe I don't want to get out of bed right away. Maybe the bird doesn't want to get out of the cage and step up on your hand. Maybe he's like, hey, come on, I didn't get my sleep. Okay. So we have a question, and from Reiko. When giving eggs as protein, is cholesterol high but yolks are good? Are egg whites harmful to birds? Some veterinarians in Japan say that broccoli is not given to birds. I don't think it'll harm birds because it is a vegetable rich in calcium. So they would like your answer on that. So the first part is about eggs, and then the second part is a broccoli.
And so the question on the eggs was, I know there was an egg white.
So eggs as a way of offering protein so I guess are egg whites okay to give birds? Are the yolks too high in cholesterol? I think that's what they're getting at here.
Yes. And I would say, you know, if it fed in moderation, no. I would say fed in moderation. That would be my thoughts. I know that it's not, you know, but that's the answer there. Fed in moderation, and then egg whites. I have not heard anything that is problematic as feeding egg whites, and I've known a number of people that have fed eggs, not necessarily on a regular basis, but as a kind of a, not necessarily even a treat, but giving them a little bit extra there. And then the next question was broccoli, and we haven't had any issue with broccoli being fed. It's not something that it's just if the birds like it. That's the one question. I think I had mentioned we had like 20 around 20 blue front Amazons, 15 to 20 blue front Amazons in, and we fed them all the same diversified diet. We had a little apple, we had a little orange, we had cheese, we had just different things, and so it was kind of like it looked good, Now, when we fed it to them, one bird would eat this, and one bird would eat that. One bird would leave. They had a different palate on what their tastes were. So you can offer, and I don't see anything problematic with broccoli. Never have heard anything bad about that.
Okay, and just going back to your answer about in moderation, so I'll use the eggs as an example. When you say moderation, do you mean like not every day, or a little bit every
that's
day?
What I would say, not every day. And what I would say is that you want to try and we're all creatures of habit, right? Who wants to wear a mask? I mean, my life, I've never worn a mask except during surgery. So I'm doing surgery all the time now. And there was nothing better than after surgery than taking off the mask, right? But we're all creatures of habit. And so we have our likes and dislikes. And so in providing in a regular diet, and this goes along with regulating the GI tract. If you do something unusual or change up on a regular basis, our GI tract changes up and lets us know it, just like the birds do. And so when I say in moderation, looking at 3 to 4 times a week at the most, and in small amounts, you want to make sure that the bird concentrates on the primary part of that diet. And that would be, if you're going to have a pellet base, you have depending on the bird, and then you have a portion of that with seed of some, there's variations of the seed from millet sprays to, like I said, all the products that are out there, and variations of those. And then also when you're looking at supplements and having the calcium supplement and things like that. So moderation, and looking at some of, I've mentioned the Puerto Rican Parrot Project, where they're U.S. Fish and Wildlife Service, aviaries, they have the diversified diets. That's when they were feeding parrots, and in them they would make their own seed mix, and they had pellets, and they had everything that I'm talking about, and they have their own papayas and everything. They just go and pick or what have you. But every day they had something that was a little bit different for those birds. Now, we don't always have that luxury, and that's why you try to do what you can with the time that you have to provide those diets. Some people have more time than others, but that's why having the pellets and the seed, and like I said, was getting back to on the Puerto Rican Parrot Project, you have the millet. They had millet seed for the Puerto Rican parrots, and so we're talking about 300 gram parrots, and that was in the mix. And I said, why are you wasting your time putting millet seed in the parrot mix? And that's when they said, Tom, you wouldn't believe it. Those birds eat that millet seed. They go after that millet seed. And so that's what we're looking to try to achieve. We don't know what the daily recommended diet is. We know that parrots are out there in the wild, and they're eating everything. They're eating everything, and it's part of their way of getting their nutrition and being as healthy as possible. We can't provide those wild diets. We can't provide that diversity. We can provide the diversity that we can to try to help them be as healthy as possible through proper nutrition.
Oh wow, yeah, the millet seed's funny because it's so small compared to the Amazon. I imagine it's just like little tiny.
Yeah, I know. I couldn't believe it. Yeah.
So I have so Brenda asks. So this is specific. It's going back to the Bornavirus disease. So is Lafeber's EmerAid omnivore suitable for feeding Borna disease virus, like BDV vomiting in birds? Is that helpful for that? The EmerAid?
Well, I mean, the EmerAid is helpful in stabilizing a bird that is not doing well. So it's helpful in stabilizing the bird. Unfortunately, some birds who have PDD, and again, I want to try to get away from the Bornavirus and PDD being used synonymously. Okay. The reason I say that is because some birds with PDD, they can't identify the Bornavirus in. So let's just say PDD, proventricular dilatation. Maybe we can one day use them synonymously, but at this time we just they're still working on it, still working to find that connection. Like I said, we believe there's something there, but exactly how it plays into it. So taking into account that some birds with PDD, they can't identify the Bornavirus, that stabilizing the birds, but you have to remember, it doesn't matter what you put into the bird, it has to go down that GI tract. The GI tract isn't functioning, so just putting it into the crop or the stomach, it needs to get through to the intestinal tract. Now, it's going to be extremely helpful, and in most of the cases, what you have to remember too is that the birds are not, for the most part, they're not anorexic, meaning they're eating. They want to eat. They feel hungry. So that's it's not a problem with them not eating. It's just a problem with function. The thing with the EmerAid, it has to be, most of the birds are not just going to eat a liquid diet at that time. And that's why if you stabilize the bird, you could possibly, if the bird's not doing well, it has, in many of these birds, because the GI function isn't working well, you have secondary bacterial infections. And so that will complicate the disease process. And so they're not feeling well. They may be, and so by not feeling well and maybe ill over and above what they're just not, they need to be stabilized. They're dehydrated. They have secondary infections. The EmerAid in the hospitalization to try to recover those birds and possibly give some anti-inflammatory medication that would help with this condition, along with the EmerAid, will help stabilize those birds. But long term, you want that function back where, and again, those birds are eating, and so a normal diet is going to be less stressful than if you have to tube feed them every day, which is basically what we'll have to do in a hospital setting. But we can get the birds to, if needed, to try to get them to eat it. But for the most part, they're going to be eating something and be more amenable to eating something they're familiar with.
Okay.
But it would help definitely to stabilize it. But we have more of a complicated factor, just like a lot of the questions.
Yeah, delivery.
That's what's so much fun. This is, as far as trying to look. It's not always a simple answer. There's a lot of factors involved that you have to think about and to address to try to get to the answer that's going to be the most helpful.
Definitely. And so with that said, I have one final question. Hopefully we can squeeze this one in. It's from Elizabeth, and it says, my 44-year-old Amazon no longer walks upright. He leads with his beak on the floor and then takes steps. What could be a possible cause of that?
How old is the
44 years old.
How many?
44 years old.
Mm-hmm. 44 years old.
Yeah.
Well, for the most part, you have an Amazon in human years, and my estimation is 100 years old. It's a geriatric Amazon in my book, and I know we had a 51-year-old Amazon come in this Tuesday. Okay, this week. How about this week?
Wow.
And that is highly unusual. And any time that you have an Amazon or an African gray of that age, you just have to understand that you're looking at that age. It's akin to a 100-year-old human, and all of the disease conditions that are associated with being old. One is that for the most part that there are, and if you get an eye exam, you'll probably see that there's lens opacities or cataracts, if you will. And so it may not be able to see on that. Also, in some of the older Amazons like this, you have cardiovascular disease, and the cardiovascular disease can affect its general, I guess, how it feels. And so this is something that could, how it moves around, and with that, or joint issues, arthritis. And like I said, when you're talking about 44, you're talking about an older bird. Now it could live to 51, it could live to 60. And I think Brenda had mentioned that there was some that are old, but there was also a lady in France, like I said, that lived to 120. How many people live to 120? But somebody did, and so you're looking at this. So it could be joint issues. That's, and so you may want to look at putting it on intermittent anti-inflammatories, but also in an eye exam. Anytime you bring in an older bird to a veterinarian, you have to remember that it is stressful, just no different than when we go to the physician. I think most of us are stressed, like, oh my God, what are we gonna, there's this underlying, I'm going to the doctor. And so birds don't have to rationale, but they know they're going somewhere and they're gonna be handled and treated. in a manner that they don't agree with. So they're going to struggle. And so you have an older bird, and I'd say anytime you bring in an older bird, no matter how careful we are, there is a risk, an increased risk of an injury or something occurring. And it's low, but at the same time, it's just like, you know, you hear of older people that fall and break their hip. Well, what they've determined is, you know, I think that at this point, it's not that you fell and broke your hip, that you broke your hip initially and fell, you know. And so you were walking fine until your hip broke and then you fell. But you can also trip over something or whatever. But there's a lot of people that are actually just walking and then fall because their hip, because the bone is older. So there are some increased risk, but sometimes it's just you have to get the animal checked out, the bird checked out, to see what the issue was. We had a little linealated parakeet that did the same thing. It would kind of walk around, and its eyes, it had what we call blepharospasm, or kind of like the lids would be closed, and it would be leaning in. It wouldn't stand straight up. It would kind of lean in, and we had difficulty with it, and trying to make a diagnosis, just couldn't figure it out. With the ophthalmologist with this little parakeet, the ophthalmologist, the specialist, looked at uveitis, which was inflammation within the eyes. And what it ended up being was cancer. It ended up being a lymphoma. And so that caused the bird to have an abnormal, just like you're describing in the Amazon. But I would think that the Amazon may have ocular issues, but also may be contributing as far as like arthritis. I don't know how cardiovascular disease in particular would be that, but you're looking at geriatric conditions that are probably associated with that. And there are some medications that may help, but also trying to identify what the eyes are like, or, you know, if there is some arthritic conditions that can be treated with anti-inflammatories, may make the bird feel better.
Okay, thank you. That, I believe, is all we have time for today. Hopefully we'll have you back in August for another episode, another webinar on Ask the Vet. More questions. These are really interesting cases that we explored today. So,
well, yes, I have to commend everybody that participated, and everybody with the questions. And I know that sometimes it's frustrating for you, and you'd like to the one thing that I would say is that it's a challenge. It's a challenge for the doctors that treat your birds. And of course you can see how involved some of the aspects of these cases are to try to get to the answers. But thank you so much, and I enjoy these questions, because this is something we see quite often. Not these particular cases, but cases similar that I think about quite a bit.
Oh my gosh, I can imagine the variety of causes and cases, and can be endless, it seems. But you know, you always seem to find a way to kind of pinpoint the obvious or the initial causes to look at. So interesting. It's a fascinating science. So just want to say thank you again, Dr. Tully, for joining us today. It's always a pleasure to have you on with us.
Yes.
So we'll see you back soon. Next week, next Friday, we have another webinar. This one's a little interesting because it's going to be species specific. We are going to be joined with Lisa Bono, and she is going to cover the topic of the gray way, understanding the African gray parrot. So that should be a very interesting topic. You know, grays, they are definitely an interesting bird, just because of their intelligence and their abilities to mimic and talk and their behavior. So I am very looking forward to that. So hopefully you'll join us next Friday. Dr. Tully, thank you again for that insight today. Appreciate it. And everyone, I wanted to say thank you, everyone. Make sure you check Lafeber.com for our webinar series. And in the meantime, be safe and all the best to you and your flock. Bye, guys.
Good weekend. Thank you so much, Laura, Brenda, and the Lafeber Company. Thank you. All right. Till next time. Bye-bye.
Till next time.